Deputy Speaker, one of the great challenges that we've all faced during the pandemic has been providing mental health and wellbeing to people in our communities. Many of us are very conscious, obviously, of the direct health issues that people were challenged with, and I've spoken before on thanking our doctors and nurses and healthcare professionals for the work that they did. But obviously during such a time, people who suffer from issues like anxiety and depression would have been exacerbated by the circumstances that we were in, but also social isolation. So people who would normally be out and about and accessing their support networks, I'm thinking of the frail, the elderly, people with a disability, weren't able to do so. And so the pressures that puts on people for their mental health and wellbeing is significant. And I want to thank two local organisations, our Headspace Wollongong service under Grand Pacific Health and our local Lifeline services. They did a Facebook hookup with myself and the member for Whitlam during the peak period of the pandemic to talk about the issues they were facing and our community was facing and the significant work they were doing. We did ask them to give us some feedback on what lessons we've learnt from that time that might be something useful to take forward, and I just want to share that with the chamber. Ron de Jong from Grand Pacific Health, who manage our Headspace Wollongong team, said that the expansion of MBS to cover telehealth was a significant improvement. Their clinical staff reported they were able to provide support to clients in real time in their own home, and there were benefits that they saw from that. Families who are experiencing conflict were able to dial in from separate locations or even rooms in their home. Others who engage with the service who might not have done so otherwise as a result of anxiety or other concerns. The barriers young people face in attending a centre in person are not always just geographical, and being able to do these telehealth connections were a real boost to their ability to service people. Similarly, they said the benefits of electronic prescriptions to allow for seamless remote service delivery were a positive out of that experience. And other item that they raised was individual placement service model. It's currently available on a trial basis at limited Headspace centres, and the model enables a vocational expert to work alongside a young person who's engaged with the service and wants to find work. And that, given especially we're all concerned about youth unemployment, they saw as a really important initiative and something that could be kept going forward. So I thank them and our Lifeline services.
Cunningham and call the